Hi pals, it is I. This is the new haircut after I also did some of my own DIY hacking, but it's fine. We're living, I guess. So another week I didn't think I was going to post a video and then I went, oh, this is the thing I want to talk about, so here we are. So I want to discuss chronic illness and mental health, and mainly it's the point of the importance of trauma-informed and specifically chronic illness-informed mental health care. If you are from the UK or know people in the UK, you know it's a fucking shit show over here for so many reasons. So many reasons. One of those reasons is our mental health system, well-being system, what the fuck ever, has had so many cuts over the years, and like I've been in and out of that system for the last decade, and it's never been good. My experiences have been like 70% bad, and they have not gotten better, and they can't get better with the lack of funding for a start. But one of my main problems I have come across with not just myself but friends of mine with chronic conditions, whether it's autoimmune conditions like my Crohn's or Takayasu's, or things that are kind of in the between realms of chronic illness and disability, blah blah blah. Either way, everything is disability. That's my stance, is everything is disability: mental health, neurodivergence, chronic illness, physical disabilities, limb differences, being deaf or blind, deaf and or, because that's also possible. If you have something that is a challenge to live with because of our society, let's say that, then you can identify as disabled when it comes to your physical body form and health. I don't know if that made any fucking sense, but here we are. But I specifically wanted to speak more about the kind of a mixture of chronic health conditions and dynamic disabilities, where things kind of go up and down. They don't ever sort of stay the same, or they don't have a genuine increase or decrease, that they kind of go up and down whenever the fuck they want in it. Because that's sort of been my experience with hypermobility. I think it's technically called spectrum disorder now, but my diagnosis is hypermobility syndrome. Also true for HEDS, which I believe is under an autoimmune condition diagnosis. That's how I feel about fibro, which I also believe is, I think it's now starting to be explored whether that's an autoimmune condition. It's kind of like neuro/autoimmune related. I've experienced that with my Crohn's and with my Takayasu's. And like generally there are a lot of really specific things that you go through with these conditions that are just not helped by mainstream mental illness care, even in private circumstances, or if you go via charities, they are just not equipped to deal with you, basically. And I said as well at the beginning, it needs to be trauma informed as well, because we go through so much trauma just living our lives and trying to keep ourselves alive. So my personal experiences with trauma, you can go and have a look at the rest of my channel, because there's a fuck ton of me talking about my trauma on here about chronic conditions. But like my personal trauma has included abuse and assault from medical staff, severe pain that has not been pre-warned. The severe pain is a very common cause of trauma. The visceral ableism of living in this society is extremely traumatic. The ways people speak to, about you and treat you, either from denying you're disabled or just completely seeing you entirely differently because you're disabled, and thinking you're worthless scrounger, those sorts of things. There's been a lot of discussion on disability Twitter, and I'm sure in other spaces too, and I say this a lot with my own trauma-informed therapist, that, CBT is, for the most part, for a lot of people, is actually just a form of self-gaslighting. And both CBT and mindfulness are basically do-it-yourself mental health prescriptions, basically, because neither of them really involve therapist care very often. A lot of CBT, from what I remember of my experiences on it, is a lot of homework you do yourself, not in session. Yeah, mindfulness is just basically meditating by yourself in it, like meditating at home. So, you know, they just prescribe these things as like a all-in-one band-aid because they don't have the staff, don't want to use this money on you. And then even if you did see somebody, they have no idea what they are doing. Within my first year of diagnosis with Crohn's, I had some extremely low lows. So low, I felt so alone. I didn't think I could continue doing this. I'd been severely traumatized and was having PTSD, panic attacks every time someone came near me with a cannula or a needle for blood tests. You know, I was basically not functional when I needed to be, because those situations are so severely based on how I'm going to be perceived by doctors and other medical staff. It got to a point as well that every time I entered a hospital or even a doctor's office, I was shaking. Every time they took my blood pressure and pulse, I was always tachycardic because of severe anxiety. So like my mental health was directly affecting my physical health, because as well the release of stress chemicals or hormones, I'm not sure which one it is, like cortisol I believe, is one of the factors that they often look into with a lot of conditions like mine. And it's one of the things that they think about that could possibly be actually a trigger for flares or even just the first onset of disabling conditions. They also think emotional trauma can be what triggers a condition to start. And from, I mean, looking at my life, I think I've talked about this in other videos, but like looking at my life, I can sort of locate at least one emotional trauma, like directly before or around the onset of certain conditions. So like my Crohn's started after I sort of came back from uni, and my last like week or so when I was at university was extremely traumatizing. I was extremely distressed emotionally, mentally, that I'm sure that could have possibly been a factor for that. And for my fibromyalgia, there had been some really, really traumatic events happening over the course of a few months before I noticed I was having fibromyalgia-like symptoms and went and got diagnosed. So with the pattern of a lot of medical conditions possibly being triggered off by trauma and mental illness, you can't separate them. You can't separate these things either because of the systemic issues that come with being disabled and chronically ill, the complete life changes. And if you're a chronically ill person working full-time in a traditional job, there are so many barriers for like accessing work, trying to pay your own bills, trying to, you know, not get fired for being disabled, which does still happen. They just call it something else, or they just still say it to you. Like that's happened to me in the past. I was fired because I was disabled, and rather than making any adjustments in the workplace so that I could actually do my job or anybody else can do their job, they often just tell you to fuck off. Like there is no separating mental well-being from physical well-being as a chronically ill disabled person, because they are also inherently intertwined with each other and with the system that we currently live in the UK. I took part in a Crohn's disease related research study yesterday evening when I'm filming this, so Monday evening. It was a mixture of patient experiences when it came to monitoring their disease, so you know, things as small as blood tests and stool samples to colonoscopies, MRIs and other kinds of more invasive procedures. And then also like, hey, this is a new procedure that has just kind of been developed, it's not widely available, but this is how it would work. How would you consider this? So, you know, that's as a general overarch of that. I don't think I can really discuss it much further because it's a study, but I don't really need to. But I just want to talk about some of the things I mentioned that I think are relevant and important, that are partly linked to that as a whole, but linked to this topic I'm talking about here of like, we need a better mental health system in place, full stop, obviously, but also for specific care for chronically ill people. Many of my disabled friends, whether they are chronically ill, disabled, or neurodivergent, things like that, we all have a lot of really intense trauma. We have really awful bouts of depression or other conditions that are like mental illnesses, whether it's BPD or OCD, depression, anxiety, like we don't just have the condition we've been diagnosed with. And as I mentioned in my last video about EDs, I have found that a lot of my mental health issues have definitely directly stemmed from systemic failures and not being appropriately diagnosed and cared for. I am aware that there is a IBD, so Crohn's and colitis specific psychiatry care in London. I believe they also have an inpatient facility, because then that's the other thing. If you did desperately need to access mental health care as someone with an IBD, a lot of inpatient psychiatric wards, things like that, do not have any understanding or capabilities of caring for physical chronic illnesses. Because like I've thought about this in the past, just curious, and I have really strict Crohn's related intolerances, as I've talked about a bunch on here too. I also have like neurodivergent texture and taste sensory kind of sensitivities that would prevent me from eating certain foods. I don't believe they can or would care for you properly, basically. Like, I have no other way of saying that. Whether they want to or not, I don't think they would even give or provide options. Obviously, that is just from my general assumption based on my many years of experience of just the system here in general, and nothing based on actual experience or real knowledge of what it's like. But that's my assumption. If I'm incorrect, then cool, but I highly doubt I'm incorrect. But besides that, a lot of like mental health care is really just surface level and turns a lot of it round onto the person trying to get help. I have often been told that, that's because I think this way, and that's something I have to change. And whilst I do completely understand that, yes, healing from trauma is my responsibility, they don't provide appropriate care or tools 95% of the time to be able to do that, because they are not trauma informed. I feel like pretty much the entire population has experienced some kind of trauma. So I think the basis of mental health care should be trauma informed, full stop. That should be the complete bottom line, base level of this all, because everything I've experienced and heard from friends of mine who have been through different systems with different conditions, they often find that a lot of the things out there are just sort of like, this is your fault. This is your fault for being this way. This is your fault for reacting this way to people being awful to you in the past, which is just going to make everything worse. A lot of mentally ill people blame things on themselves already. A lot of people have been gaslit by people in their life or people in the medical field, whether it's within mental health care or just in the general physical health care. Like I could probably say I've been gaslit by each of those categories more than once, and it has taken me a really long time to be able to fight back, both inside my head and outwards, against the gaslighting. And even still, it's not perfect. I think I talked about this again in the ED diaries, that I still really struggle to identify, that my reaction is valid and not an overreaction, or, people are treating me poorly and my response to that is appropriate. I still regularly think to myself after something awful happens with someone or some company or whatever, that I'm like, am I just overreacting to this? And that's from literally years of gaslighting from multiple people in my life, to the point that even if I have physical evidence of these people doing nasty gaslighting things, I still doubt myself, and I will repeatedly look over the same evidence over and over again, making sure I've definitely taken in what it says. And that's why I then tend to go round to friends and family to be like, am I responding appropriately here? Am I mad, or am I reading this right? Am I reading this right? After my first few official diagnoses were dyslexia when I was really young, around 6 or 7 years of age. I saw a therapist then, based around my parents' divorce, who gaslit me as well. Thanks, babe. Then I was officially diagnosed with the hypermobility syndrome at like, I don't know, age 20 in 2013, 2014, something like that. And again, was gaslit further around then, even though, yes, you have something wrong with you, we just have nothing for you, we can't help you here. And they put me through like over a year of physiotherapy to only just further damage my joints. And also, like, from what I know now, there were and have been hypermobility specialists in this area for at least 15 years, if not more, and nobody knows they are there. Because the OT I finally saw is a hypermobile hand specialist. Nobody referred me to her. There is a woman who works with, I think, Brighton University, I can't remember, but she's a neuroscientist who specialises in hypermobility related research and conditions, and a lot of her research branches out to the connection with like ADHD, autism. One of the studies specifically is about hypermobility and anxiety. I don't know, she does a lot of research in this area, linking hypermobility with other things. Like, these people have been here for longer than I've even been fucking diagnosed for, and I've only just really started to find out these people fucking exist like 7 or 8 years on from this diagnosis. So love that, babes. There is no mental health services for these things. Then I was diagnosed with fibromyalgia in 2016. Again, no mental wellbeing support, babe. I've been in and out of NHS systems. When I was at uni, I saw like, I think 3 different counsellors at the uni, because again, it was literally the same as the NHS system. You've got 6 to 12 sessions, if that. I also use local charities. So when I was at uni, I used the local charity counselling service, which was okay, but again, 6 to 12 sessions. I then used, I don't know whether it was a charity organisation or if it was something else, but it was basically for trainee counsellors and therapists to get some experience. I did that for a while because it had sort of like an open-ended appointment system that I could just keep going. So I did that for the remaining time of my university period of whatever. And whilst I'm not sure I necessarily wanted or needed the support at the time for the physical health conditions, there was a lot of other stuff going on at that point in time. I definitely think I avoided talking about them though, because not many people generally out in the world know and understand anything about chronic health conditions. So why would my therapists or counsellors, you know? So then I came back home and had my diagnosis in 2019 for Crohn's, and I had been put through so much physical and mental pain through like this system. So I obviously had like a lot of physical and mental unwellness just from flaring with my Crohn's to begin with, and realising that my doctor didn't do the right tests several years ago when I first came to them with gastrointestinal kind of problems, and realising, wow, oh no, the system, it's broken. Then having to go on a really long wait list, even though I was put on the shortest semi-local wait list that literally took like 4 months for the scans to be done and then like another 4 months to be seen, as well as a colorectal surgeon in another county or whatever being so disastrously rude to me for no reason, as if I chose to go to see him there. It's just where I was sent by my GP, but it was my fault that none of my files were on the system because I'm not within the catchment area or something stupid, even though I've definitely been to that hospital for other things and not had this problem before. So I didn't understand, but he was so awful to me, provided me with medications that gave me migraines and didn't even help. because he'd misdiagnosed what was going on with me then. The thing that was misdiagnosed by this man was diagnosed correctly when I had my colonoscopy. I was put on my first dose of steroids right before I finally saw someone because I was just not doing well. Then June, finally diagnosed, and then literally on the same day as when I was assaulted and held down by a member of staff as I had a panic attack. So cool, thanks for that, which led to the next 6+ months of PTSD, panic attacks every time anyone came near me with a cannula or a needle, and did prevent me from accessing care in some situations. I then had erythema nodosum like 6 weeks later, ending me in the local A&E with the dots all over my legs that were causing the most severe pain I've ever felt. I don't know if I can even say that anymore. I've felt so much pain, but it was so bad. It would shoot through my limbs. I felt like I could barely even walk, like the muscles just stopped working. So I was put on another lot of steroids, and all of my care was processing to be moved to the local hospital, which hasn't really been any better. At this point, I still hadn't ever met any consultant. I have still not met a consultant face to face. My consultant has only ever spoken to me on the phone because of the pandemic. So I had a panic attack in A&E because they wanted to get bloods from me that I'd already done earlier in that day. So that was a no. Stayed there until like 4:30 in the morning because they forgot about me twice. They also left me in a chair for a really long time, and sitting in a chair with my legs down would lead to like swelling in my feet and my legs because of the erythema nodosum. So yeah, that took a while to start getting better, and then I got an abscess in my butt that was really painful. 2 lots of, what are they called? And then minor surgery. I had to turn up to the hospital on a Saturday for a scan. No one told me not to eat in case they would operate on me. By the time someone came up to me, I'd already eaten something, so I just went home and had to come back to the hospital half hour away, 45 minutes away, at 7 in the morning to wait and see if they would take me. So I had to starve myself that day. They did not take me. Had to come back the next day and do the same thing, where they did take me, and they did also sort out this thing that was misdiagnosed a while back. Thanks, lads. They did not prepare me though for the abscess related aftercare. No one told me it was now officially called considered a fistula. No one warned me about the pain of packing and, you know, cleaning out this wound, especially at the very beginning. I was screaming and crying in the nurse's office alone with the nurse, who I'd never met at that point before. This poor woman. She was very lovely, so like I have absolutely no complaints about her. If we'd have known, one of my family members would have come with me. Well, that's what they said. They all felt so bad that I was in there on my own. And it's like, well, you didn't know, I didn't know. You know, I don't blame any of you for that. I don't blame the nurse for this either. She had no idea what or if I'd been told anything, you know. You know, I had a really intense like first year and a bit with Crohn's, and then I was diagnosed with tachycardia soon after, and further trauma happened. I started to see this local charity for some talking therapy. I'd already reached out to the NHS services in this area, and they basically didn't want to take me because I have BPD as one of my diagnoses on my, you know, official medical documents. More good, fun and fantastic things about the healthcare services. They didn't want to take me for that reason. And I had managed to talk her around to it because it's like, you know, I don't want therapy for my BPD. I want therapy to kind of talk through and process my medical health, physical health related stuff. I just felt really alone at that point in time. And it was kind of before as well I found better spaces and people who did actually understand some of what I was going through to talk to about any of this. So I wanted, and I still need, this very separate space with like a mental health professional to discuss these things and process what's happened, you know. But once again as well, it was like, well, we can only do like 6 to 12 sessions anyway. And she gave me some details for local charities, and apparently I accidentally picked the fucking Christian one for a start. But I spoke to this lady for a while who seemed okay, but I definitely felt like I was doing a lot more emotional labor to teach her about my perspective in life. And this is like a good example of why it's important to have and find a therapist who can understand, you know, systemic situation, because this was around when George Floyd was murdered and the BLM marches and protests were happening like in full force. This counsellor didn't seem to understand why that was so distressing for me. You know, besides caring about other human life, I kind of had to phrase it in like a, well, you know, I very well could be next on the agenda for who to be eviscerated. You know, that's not even really how I look at it, because I already am and have been, especially in the UK, on the attack list as a trans disabled person. But, you know, I had to phrase it in this quite gross way to get this old white lady to understand why watching other marginalised people go through such traumatic and disgusting treatment affected me directly, because I know what that feels like. Like, obviously I don't understand what it feels like to face racism and things like that, but as a general like overview of being a marginalised person, the microaggressions and treatment is vile. And it's, you know, I just find it very difficult to not, like, I cannot comprehend how people don't give a fuck about other people. Like, watching what was happening, it was still affecting the UK as well. Things were happening here too, but, you know, watching these things going on was distressing, and they were making me physically unwell too, because the stress was triggering some of my autoimmune conditions as well. Like, I was getting really bad chest pains from the stress and anger as well. I was so angry at some of the fucking idiots out there and what they were saying. And that's also how I feel when it comes to trans and disabled issues. And that's why I have to kind of disconnect, otherwise my physical health will just absolutely turn to fucking shit. This is why it's important to either have a therapist who is well informed, either by their own choice. No, definitely by their own choice. You know, being forced to be informed does not make for better care. It either has to be from someone who has put the effort in to understand the systematic problems, or from someone who knows what that is like. I've had enough. I've had enough. I need to find somebody else. And honestly, I feel like it was destiny that I found my current therapist as fast as I did. She was the first person I messaged, the first person I kind of really looked at on this database of therapists, basically. You know, my therapist has Crohn's too, and that has made such a massive impact. Even just the talking therapy we do, if it's not related to specifically EMDR type of things, we do a lot of talking therapy, but, you know, very much about trauma. I, you know, never had to explain anything anymore. Even when it came to my other conditions, she had her own experience to understand what it's like to go through the UK health system right now, and just all this, you know, personal experiences of being diagnosed with a condition that completely changes your life, you know, things like that. That alone made such a difference to my care. But also I got very lucky that she's, you know, LGBTQ plus friendly. She is also like, she's open about not knowing a lot about neurodivergence at all, but her reaction to me talking about being ADHD and autistic, I couldn't have asked for a better reaction, honestly, especially from someone who doesn't really know a lot. You know, she never started treating me differently. She spoke to me the same way. She has listened to what I've said. She's never brushed off how I felt about these things, you know. And I think because she's a trauma-informed therapist, that has been the basis of everything I've said and her responses to everything, that she can understand that everything I've been through has caused trauma in one way or another, and she thinks that I have CPTSD. You know, I don't know whether that's even an official diagnosis yet of the DSM-5 or whatever, but, you know, having someone validate that I do indeed have trauma, and I've been through trauma enough that, you know, she thinks I would classify as like an actual separate diagnosis on its own, you know. And like, I look at a bunch of my friends who have chronic conditions or other disabilities and how they are all struggling. Obviously won't go into detail about any separate people, because, you know, those are not my stories to tell. But I want to just say, as a whole, reflecting on it and looking at my friendships with other disabled, chronically ill, also generally marginalised people, everyone's suffering and everyone needs specific tailored care. I have some friends who have queer therapists and counsellors, and they've found that that's really benefited them too. But again, I feel like those therapists and counsellors also have a general understanding of what it's like to be marginalised and face systemic problems, that they can kind of use that to understand disability too. In general, I feel like a lot of trauma and internalized ableism comes from the fact that we don't have official tailored mental health care for disabled and chronically ill people. There is no real format for how to care for ourselves, how to navigate the system that we're in. The only other person I even really spoke to in the mental health system who I felt really saw me and understood me was a pain management psychologist, I can't remember which, but she also lived with chronic pain herself. Like, I don't know anything further about her, but like, she was the first person I ever saw that I was like, wow, okay, you get what it feels like to just be in pain all the time. And this was before Crohn's. This was in like 2017, when I was dealing with hypermobility and fibromyalgia related chronic pain and fatigue all the time. Still do, but it was just that at the time. RIP. And like, the only times I've really felt seen were by these people. I've had good experiences with other counsellors and therapists too, who saw me for different things. Like, they could see the sadness I was experiencing and the trauma I was experiencing of other things and other people. I've had a younger counsellor who could understand what it's like being a young person right now. He was literally a year older than me. You know, I felt seen by him, because it's like, wow, most of the fucking counsellors I've had are, you know, 40 plus, have no idea what it's like to be my age at that point in time. I've had one man who was a counsellor. I've literally only had two men who were my counsellors, and that's these two. This was an older man who was just a very soft and gentle energy, and he definitely had a very emotive face and made me feel like he could see and understand that I was not feeling good and I was struggling. I've had a few other mental health counsellors and stuff. I had one lady who was really good before I started university, and that was sort of when I was trying to pick up the pieces of myself and start putting them back together in around, I think it was 2014 or 2015. So like, I've had good experience with other people, but that was before I really understood and saw how much disability and chronic illness affected my life entirely. And also, I just feel like my current therapist sees me as like, I don't think she's much of a capitalist herself, so I think she can understand me in that aspect too, that every doctor wants to make you functional enough to work in capitalism, and that's just not my aim. Having lived such a stressful, traumatic life where a few different points I just didn't want to be alive anymore, you know, my priority isn't working. My priority is to be happy, for one, but also to help enact some change for the future, because I am done. I'm done. I have decided that I am going to be a very loudmouth, disabled, trans bi activist, and that's it. I have things to say and no one will stop me. I've said so many times that I wish I could lend out my current therapist to my other friends with chronic illnesses, but especially like my Crohn's friends, because it has just made things so different for me. I have a space to kind of deal with the shitty things that have happened with someone who not only understands it, but also understands how trauma works, and also basically wiped a lot of my trauma responses clean when it came to medical trauma, because so many of us now have physical and mental reactions to hearing certain information or going for certain procedures and tests that make those things so much more difficult to deal with. And we're still young and we just have this condition for fucking ever. So there, you know, if we're dealing with so much trauma right now, how are we going to keep continuing with more trauma building up over the years? Because, you know, I expect to be traumatized a lot more, but at least I know I have this person and this method that helps and works for me. I'm obviously as well not saying that EMDR is for everybody. It probably isn't. I'm also not saying that, you know, CBT doesn't help people at all, but I have found most people do not find it helpful at all, and it is self-gaslighting, but that's just my opinion and other people's opinions. You know, it is different methods for different people, and I just really feel like trauma-informed therapy for the chronically ill and disabled would be like number one. You know, you can mix it up and use different kinds of therapy practices together. You know, it's not just a one fix for everybody. It's finding out what combinations work for everyone, but from a basis level, we are all traumatized and we need to deal with that trauma because we know more trauma is going to come. Something else I brushed upon in my ED Diaries video, and probably many others, is as well like the impact of medication side effects generally, but also specifically a lot of medications have an effect on your weight. And because ED's diet culture are all so woven into society today, they are going to have an impact on your mental health and well-being if you aren't in sort of like a recovery fat positive kind of space or mindset. You need people who can understand dealing with those sorts of things. Like with trauma, I feel like many people have disordered eating, if not an eating disorder full on, and they're just so normalized in our society, and so is the normalization of like hating fat people or hating being fat, that's just more layers of things that need to be addressed and accounted for in mental health, well-being support spaces. Even though I've been in the process of recovery for many years, it was still an impact on my mental well-being when I was put on steroids long term and saw my face change, my body change, when I'd been sort of like happy, stable for quite a few years at that point. I kind of have the luxury of already been educating myself on those things and kind of took a radical stance of like, hey, well, it's, you know,
what's being a bit fat compared to being dead?
There are still flaws in that thought process as well, but as like a stepping stone to fat positivity and fat acceptance, it's an important one on a personal journey, because many people would literally rather suffer with awful side effects or symptoms from chronic conditions, or literally they would rather die than be fat. And I think that's fucking mental. I think that's ridiculous. You know, I can understand the struggle that comes with putting on weight and not recognizing yourself, or facing more systemic problems like fat phobia from people in the street or in clothing shops or online. You know, you can't exist peacefully, but you know, it's another thing added to chronic health and disability. Also, fat phobia is incredibly rife in the medical industry, and I've been told on more than one occasion that my weight will directly impact joint pain, which I found out recently is not entirely true. Also, I've seen that the actual statistics of people with type 2 diabetes versus, you know, skinny versus fat is not as straightforward as they are made out to be. And actually lots of type 2 diabetics are skinny, and many of them are not diagnosed because their symptoms are ignored because they are skinny. Whereas lots of fat people are told, first off, we need to check type 2 diabetes. I have been checked for type 2 diabetes multiple times because of my weight and certain symptoms I was showing. I don't have it. Multiple family members of mine do, but that was like one of the first few things that's been checked, which for me, I don't mind that. I would rather get everything checked and just be sure. But then that's just another one of those side effects of fat phobia in the medical industry, where, you know, even skinny people suffer from fat phobia because we associate certain conditions with being fat, which is just not correct or true. So thanks for coming to my TED talk. So yeah, I just really have a really aggressive passion for mental health support for chronically ill people for like so many different reasons and perspectives. It also obviously continues to gain more layers as you look at different kinds of marginalizations as well. Like, as a white mid-ish size non-binary trans queer person, I talk about my perspective from that point of view, but obviously there's a lot of other things to acknowledge of, like, you know, certain issues when it comes to being a man, whether you are cis or trans, being of a certain religion, races and ethnicities. My brain was just like, is nationality the word? And also depending on where you are in the world too, because where I am, pretty much everything is free. You can pay for it if you would rather, but there are lots of places that don't have that, or other places that have something that's a bit more complex that I don't quite understand, that's kind of like Canada, Germany, you know. And as well, I've talked about a few times, I'm not out to many of my medical team as trans, because not gonna lie, fuck that. I know that's a privilege to just in some ways not have to be out, you know, especially people who feel it is important and necessary for their own mental well-being that they need to undergo any kind of medical related transitions, if it's hormones or surgeries. I can understand that, obviously, like, as someone who doesn't want or need those things, I do have the privilege of kind of being in the closet, which, you know, in itself is a mixture of a privilege and not a privilege, because I'm constantly misgendered on literally every single form and appointment I've ever in, and I hate it. But it's either that or face transphobia as well. We love that. But yeah, this is probably like a bit of a jumble. I just wanted to kind of talk about some thoughts I was having that kind of stemmed from this research meeting yesterday, that we are just not doing enough. I have all of the ideas, but none of the ability to put them into action, whether it's because I'm not a scientist or because I know nothing about politics or know nothing about the system and how it actually functions and how to get around that. Also, unmedicated ADHD brain, so here we are. So I just like to word vomit things onto the internet and see if they make any kind of impact on people. I do try to write these things. Yeah, I'm just tired. Why do we gotta live like this? Why is this the way we have to live? But yeah, I've had a sudden upshoot in subscribers, but then a severe drop in views. So if you are new here, subscribe to the channel, check out some of the videos, leave a like on this video, and leave a comment if there's anything that I've said that, you know, you've experienced or that you'd like to share some of your experiences below. Please do. I also appreciate shares of my videos. I just talk a lot of shit, not gonna lie. Disability stuff, trans, queer stuff, and very once in a while at this point books. So if any of that is of interest to you, come back, see my face, and I will see you next week. Bye.